You might be surprised to know that colorectal cancer is the third most common cancer in both men and women in the U.S., excluding skin cancers. It's also preventable and treatable if caught early. Dr. Mohammed Faizan Ahmed with Cone Health Rockingham Gastroenterology at South Main is here to talk about the cancer and the importance of screenings. Doc, thank you so much for being here today. So just at a very basic level, what is colorectal cancer?
Hey, Chad, thank you for having me here. So colon cancer is actually cancer of your large intestine. It develops from a small polyp and progresses.
And
And
who is most at risk?
so, it's what we are talking today is very important. Colon cancer is actually the second most common cancer-related death in the United States. 1 in 24 men and 1 in 26 women will develop colon cancer in the United States. Um, the risk factors vary, but anyone above the age of 45 is at risk. But you can divide the risk between genetics, meaning if someone family have colon cancer, they are more likely to develop colon cancer, which you cannot change. But there's environmental factors, meaning if they have they're obese, they smoke, they have diet high in red meat or processed food. Those are risk factors. But the good news is we can limit those risk factors and screening can prevent colon cancer.
When it comes to screening, I've seen over the years how the guidelines have changed. Can you explain what they are now, what they used to be, and why they have changed?
Right. So colon cancer was a disease of old people, but it has now becoming a disease of younger patients. Last week, I did a colonoscopy and unfortunately found a patient who's age 35 to have colon cancer, which is very rare now. It's becoming common. And so previously it was age 50 to start colon cancer screening, but because of that data, which is very clear, that the data is in older patients, colon cancer is decreasing, and in younger patients, their colon cancer is increasing actually. So the age has decreased from age 50 to 45. So anyone age 45 should be screened for colon cancer.
Why is it that the data is showing that it seems that younger people seem to be getting this?
So we don't exactly know, but it's postulated that has to do something maybe with our diet, being on high processed food, diet high in red meat, and also like environmental factors like being overweight, having sedentary lifestyle. This is what's going on here with younger patients.
So 45 is the new suggestion. I'm 42, obviously a couple of years off from that. Is that something that you really should start thinking about ahead of time? I mean, how do you go about thinking about this process?
So what needs to be understood is that it's for average risk patients, it's at age 45. When you turn 45, you should talk to your family doctor that or primary care that I should be screened for colon cancer. But if someone family have history of colon cancer, that's a different scenario where it should be started early, at least age 40. So that's important to know family history. But if someone's family has, for example, someone's parents were diagnosed with colon cancer age 40, so they will be starting age 30, 10 years before their parents or siblings were diagnosed with colon cancer.
You had mentioned that you had found polyps in someone who was in their mid 30s. How do you even thinking about someone who's under that 45 threshold? What do you do?
So, the screening guidelines are starting at age 45, but I am seeing polyps and even colon cancer in younger patients than that. So it's important to know that if anyone has any symptoms, for example, symptoms such as blood in the stool, you should not brush it away by saying, "Hey, it's my hemorrhoids," or anyone who has change in bowel habits. For example, if someone is regular and all of a sudden they are becoming more constipated, that's something to think about and talk to your doctor.
We're going to be talking more about symptoms as well as screening, testing, and the like coming up after the break. Dr. Ahmed, thank you for being here. We will be right back.